I've been trying to do a better job of defining what the role of a naturopathic doctor is in Ontario. And I, of course, am looking at it from a big picture perspective because that's what a good naturopath does, right? You have to look at the big picture, see how everything fits together. And I think the reason that in Ontario in particular, naturopaths are able to flourish and have a place in the healthcare system is because we have a socialist healthcare system where most people have access to medicine of some sort. And most people do have family doctors, but a lot of people don't. And whether it's the people who don't have a family doctor or it's the people who have a family doctor but can't get in to see them very often, or maybe they are able to get in but they're limited to the 15-minute appointment, one concern only, and they just are educated, smart people, and they know that their whole picture cannot be assessed in that short period of time. So fortunately, they have extended healthcare benefits, or they have some expendable resources that they can invest in their own body, their own health. And this is where they kind of jump from the publicly funded healthcare system into this privately funded system where we reside as naturopathic doctors. And once they see us, our initial visit's an hour and a half. So we have ample time to really go through their whole story, their whole medical history, their family history, all of their lifestyle choices, medication supplements, and all of that. And then we do a pretty great job of helping them figure out what the root cause is, helping them distill any information they've gotten from their family doctor or their specialists into a holistic understanding and a language that they're able to process. And this way they can kind of step away from Dr. Google, which is not a bad thing by any means. I really think the fact that patients have this curiosity and this drive to investigate their own health is a really positive thing. And if Dr. Google's the best that they have at the time, that's wonderful. If they can then fact check that with a medical professional, that's obviously better. But the fact that they have that inquisitive nature about their own body is definitely the first step on the way to optimal health. And I really feel like the term personal health researcher is the most accurate explanation or definition of what I do for a living. I have patients that come in with some information. We fill the gaps by doing lab testing, further investigations, and then we really put that together like a project. What are the concerns? What outcomes are we looking for? And what paths do we need to take to get there? So it's less so that I see myself as an alternative to a family doctor, because I'm not. I don't practice primary care. I don't look in sick kids' ears if they have an ear infection. I do women's health and digestion. So if somebody's coming in and they have some concerns related to the female reproductive system at any stage in their life or any kind of digestive issues, we do need to get objective data, but it doesn't need to be a physical exam in the traditional sense of the term. In fact, for hormones and digestion, a physical exam often doesn't really, nothing comes of it unless it's an acute concern. And if it is, we would refer you to your family doctor or to the emergency room anyways. But we do rely a lot on lab testing, blood testing, urine testing, things like that. And with that information, then we can kind of put together those missing pieces and really figure out what was going on under the hood and what needs to be altered so that this person can get back to feeling well.